Hello everyone, my name is Dr. Hena. I'm a consultant child psychiatrist working in London. I'm just doing a short video to give you some help to manage sleep difficulties during the pandemic. We've been under lockdown for about 3 weeks, and the pandemic has been affecting everybody around the world for many weeks now. It is quite an anxiety-provoking situation. There has been lots of changes in routine for everybody involved. Children not going to school, parents working from home, elderly people not being able to see their family and friends. So it's pretty much affected everybody. This can lead to a lot of stress and anxiety for everyone involved. And we know that stress and anxiety has a negative effect on sleep. So, before we go on to think about how we can manage our sleep difficulties, I want to give you some information about our sleep cycle. So, we have a set sleep cycle that our body follows. So, it's called a circadian rhythm. This means that we stay awake during the daytime and we go to sleep at night. This is facilitated by a hormone called melatonin that our brain produces. So during the daytime, when we are exposed to daylight, the level of melatonin is low in our body. As the sun sets, the level of the melatonin starts to increase, and then eventually, by late evening, this helps us to go to sleep. So exposure to sunlight during the daytime is very important to keep the cycle working properly. So sometimes teenagers have this habit of sleeping quite late into the day and not getting exposure to sunlight as much, and not having a routine of having to go to school these days also makes the problem worse. So my advice would be to wake up at a decent time in the morning, open your curtain and get some sunlight in, and also try and keep your nighttime routine consistent. So go to sleep at a decent time. That is important. If you're an adult working from home, try and keep a workspace separate from your bedroom. Otherwise, we can make associations between work and sleep, and that can affect sleep at night. So it's important to have that space in your mind, the workspace and then sleep, but also physically, it's important to have the space separate. We know that exercise helps with sleep. If you can't go out to exercise, please try and do as much exercise as you can at home. Also, drinking coffee in the evening can have a negative effect on sleep because coffee is a stimulant. So avoid drinking coffee after 4 o'clock in the evening. We know that some food substances like banana and milk have sleep enhancing chemicals. So you can have a banana at night before going to bed, or a glass of warm milk. That will also help. So these are the little techniques that we can do to help ourselves sleep. We know that the anxiety can get worse when our mind is quiet just before we try to go to sleep. This is identified by thoughts going around in our head. We call it ruminations. So it could be any worries or thoughts that keep going around in our head that can keep us awake. Often I give techniques like taking the thought or the worry out of your brain, out of your mind, so that we can sleep. So it could be, you could do a little post-it note, write your worries on there and put it on the side saying, okay, these are my worries. I'm going to leave it outside of my mind for the present time and I will look at it tomorrow morning. So you're literally physically taking the worries out of your mind and putting it in a little piece of paper or a post-it note outside. These little techniques often help to manage anxiety. There are other techniques, relaxation techniques, breathing techniques, distraction techniques, and mindfulness that help with stress and anxiety. Practicing this just before going to sleep also helps with sleep. And hope this information has been helpful for you, and see you soon. Take care of yourself, stay indoors and stay safe.